Science Facts on Saturday. This week, Science Fact is about keyboard. The fact that office keyboards can harbor up to 200 times more bacteria than a toilet seat is a startling revelation that many people are not aware of. This fact has been supported by a number of studies over the years, which have found that computer keyboards can harbor a wide range of bacteria, including E. coli and Staphylococcus aureus. One study, conducted by researchers at the University of Arizona, found that office workers' keyboards contained an average of 3,295 microbes per square inch. In comparison, a toilet seat contains an average of 49 microbes per square inch. This means that office keyboards can be up to 67 times dirtier than a toilet seat. Another study, published in the Journal of Applied Microbiology, found that keyboards can be contaminated with bacteria from coughs and sneezes, as well as from food particles and other sources. The study found that 12% of the keyboards tested had enough bacteria to be considered a potential health hazard. One example of the potential risks of using a contaminated keyboard was reported in a case study in the journal Infection Control and Hospital Epidemiology. In this case, a hospital worker developed a serious infection that was traced back to her keyboard, which was contaminated with a type of bacteria called Pseudomonas aeruginosa. To reduce the risk of illness and infection, it is important to clean keyboards and other commonly touched surfaces regularly. This can be done using disinfectant wipes or sprays. In addition, it is important to practice good hand hygiene, such as washing hands frequently and avoiding touching the face, in order to prevent the spread of germs. In conclusion, the fact that office keyboards can harbor a significant amount of bacteria is a concerning issue that should not be ignored. By taking simple steps to keep keyboards and other surfaces clean, employees can help prevent the spread of illness and create a healthier workplace environment. There are many articles and studies that have been conducted on the bacteria found on office keyboards. Few references are captured in the description section.